Thank you, Mr. Speaker, and I thank Honourable Ratu for his question. Just for the purpose of clarification on the different cadres of healthcare workers referred to in this question, radiologists are medical officers who have attained their degrees in Bachelor of Medicine, Bachelor of Surgery, gone through internship program, have gone through a rural appointment before joining the radiology department as part of their request for joining a specialized field, and they are responsible for the interpretation of radiological imaging such as X-ray, CT, ultrasound, MRI reports, and they do the reporting. They are pegged at they're starting on Band H, Step 5, and as for sonographers or medical imaging technologists who perform doppler scans like ultrasound modalities, they've completed a bachelor degree in medical imaging technology and have joined the workforce as medical imaging technologists, or MITs for short. Through in-house trainings, MIT gain additional skills to perform the procedures for specialized tests such as ultrasound, computerized tomography or CT scan, or MRI scanning and ultrasonography as well. Salaries for MITs, in short, start at Step 2 on Band F, and then MIT perform general radiography are paid at the same level, and those performing ultrasound scans, CT scans, mammography and MRI scans in both hospital settings and the subdivisional hospitals. In April this year, Mr. Speaker, I had stated in this August House that in the last decade, Fiji has also seen a share of radiological imaging development with the introduction of high-quality ultrasound technology, CT scan, MRI testing, and other advanced testing technologies. These developments have meant the need to increase the workforce and enhance their capabilities to operate these new advanced technologies for better disease diagnosis and treatment. Unfortunately, this did not happen, and concurrently with the introduction of new and advanced technologies over the years. So this is an exercise that the Ministry is currently undertaking with the support of our partners to address the workforce needs now and in the future, including the appropriate remuneration for our staff, and the Ministry is committed to complete this task. And I thank you for that question.
Thank you, Honourable Minister. Are there any supplementary questions? Honourable Virendra Lal.
Yeah, Mr. Speaker, sir, can the Honourable Minister inform the House, is there any qualified sonographer in the country? The reason I'm asking this, sir, because no university in Fiji is offering courses in this field. Thank you, sir.
Honourable Minister.
In general, they graduate with a medical imaging technologies degree, and as I've mentioned, once they come on board the workforce, then they are trained in the various other parts of medical imaging modalities that are available. At the moment, as part of the review, we're trying to ensure that training to be accredited is also included in the review. So as it is, they're just learning on the job, and some of the, can say, the local accreditation from various hospital settings overseas, they have been seconded to work there and learn, and then come back and perform the duties that they do perform. But at the moment, for the ones that we have, they're locally trained, and they are doing the work as it is.